In this video, I'm going to share 4 baby toys that can lead to developmental delays if they are overused. And overused is not as long as you may think. I'm talking a maximum of 10 to 15 minutes a day. On top of these developmental delays, these toys also pose safety risks to your baby, which is something important to consider before even using or purchasing them. Hey, it's Morgan, and welcome to the Passable Parent channel. I've been a pediatric nurse for the past 10 years, specializing in early childhood development, and I'm also a mom. Before we get started, don't forget to like, subscribe, and turn notifications on so you don't miss out on any future videos. And make sure to comment down below if you have any questions. I love to hear from all of you. Thank you so much. I appreciate your support. The first overused baby item is baby jumpers. Baby jumpers are equipment designed to allow your baby to jump by pushing off with their toes on the floor, and unfortunately, while babies tend to love and find these jumpers enjoyable, they can negatively affect a baby's development and place them at a greater risk of sustaining injuries. Babies are typically placed in these jumpers by caregivers from age 4 months and up. Generally, until 8 to 9 months of age, babies do not have the strength or muscle control to stand up. So placing them in these jumpers at a young age has a negative developmental impact. Babies also don't have the skills needed yet at this age to control their body movements when bouncing or jumping so quickly. When using a baby jumper, you will see these babies leaning forward to compensate for not yet having these skills, which puts them at an unnatural position or gait, and they are unable to stand up straight and hold themselves upright in the correct position. Standing upright is the position we actually need to learn skills such as walking, and these jumpers prevent that by causing baby to lean forward in that unnatural position. Also, baby jumpers teach babies to push up and jump using their tippy toes, and regular use encourages baby to stand on their toes at all times, which is not how we learn to walk. We need to learn something called flexion and extension of the foot, which is something your baby is unable to practice when in these jumpers. Learning this unnatural position of being on their tippy toes can actually lead to the shortening of your baby's developing calf muscles, and in extremely rare cases can actually result in babies needing leg casts or surgeries to lengthen the calf muscle. When your baby is under 6 months of age, their hip joints are still developing as well. And it's really important that they develop a healthy hip position, such as an M or a frog shape. And when your baby's in these jumpers, your baby is unable to form that proper hip position that we want to see because their legs are suspended and straight, which can actually increase the risk of abnormal hip development. When using baby jumpers, babies have sustained head and limb injuries after falling from these devices. And this is due to many different reasons, such as the doorway clamps breaking, if you have one of the jumpers that's in a doorway, tension to the laces causing them to snap, not being securely strapped into the actual harness, siblings or pets rushing past the baby in the swing or the jumper and pushing them into a door frame. There have also been cases of injury to babies' fingers due to them being pinched or caught in the straps and strings and chains of the jumper. The next baby item that is overused is the baby floor seat. The baby floor seat is a toy that is used to help a baby sit up before they're actually able to sit up independently on their own. Typically, they are used by babies who are 3 to 6 months of age and who do not have the head, neck, and trunk muscles yet developed to sit up on their own. Baby floor seats are often advertised and promoted as teaching your baby to learn how to sit. Well, parents, unfortunately, this is false advertising and really confusing for all of you parents. And unfortunately, I see this a lot with many baby products out there. So don't feel bad if you also believed what somebody said at face value, because they market this stuff and there don't seem to be enough checks and balances when it comes to keeping these companies accountable to offer accurate science and evidence-based information to consumers and parents. When a baby is sitting in a baby floor seat, they are actually placed into the sitting position by a caregiver and then essentially locked into this position by providing a snug fit and firm support, which actually stops your baby from being able to use their hips, tummy, back, and trunk muscles to learn to sit upright on their own and build that trunk and pelvic stability required for them to learn how to sit independently. It also doesn't allow them to build those core muscles that they need to be able to sit independently. When babies are placed in baby floor seats, they also are unable to move from side to side or from back to back. This prevents them from being able to learn and practice the balance skills needed to sit independently. They need to be able to develop those balance reactions to catch themselves in sitting. Additionally, baby floor seats can also increase the risk of a baby developing hip dysplasia, which is the hip or partial hip dislocation. That's because the baby floor seat encourages their legs to come together and in a straightened position, which is known in the medical community as a risk factor for that hip dysplasia I just touched upon. Instead, we want our babies learning a natural hip position, like the shape of an M, where their knees are bent and coming out to the side, which is not possible when in a baby floor seat. There also have been cases of injuries like skull fractures when using these baby floor seats, and documented cases of infants as young as 3 months old falling from these seats. This risk of these types of injuries only increases in the baby floor seats as your baby gets older and starts becoming more mobile when they are still being placed into these seats, because they become better at rocking and develop stronger muscles with time, which puts them at an even greater risk of falls from these seats. The next toy that is overused is the ExerSaucer. Now, while this toy can provide great relief for parents when you just need a minute to get some things done, I totally get it. I'm a parent myself. But it is a stationary play center for your baby with a sling seat in the middle to support your baby while they are standing or sitting. And depending on the type that is being used, the baby's feet might hang or might directly rest on the floor in one of those ExerSaucers with a shaped bottom hanging from it. That's not great positioning for your baby who's developing their muscles. These toys are marketed as a toy to help strengthen your baby's leg muscles so that they will learn to stand independently. And again, sadly, this is just not true. This is because these are typically used before a baby has the skills to stand up by themselves. They're being used when a baby is typically around 6 months of age, and most babies are not able to pull to stand that young. Because once your baby can stand independently, you wouldn't be using this ExerSaucer type of equipment. Because your baby doesn't have the skills yet to stand upright on their own, they actually fall forward and they rest their tummy on the front of the sling seat. This results in the hips leaning forward and their back in a curved position to keep up their head and shoulders to be able to play with their toys. They also tend to lock their knees in this position, which is the total opposite positioning of what your baby needs to stand independently. For your baby to stand independently, their feet need to be in line with their hips, and their hips need to be in a neutral position, not leaning forward or back, and their shoulders and head need to also be in line. If they are leaning forward or backwards when trying to stand, they will fall. The positioning your baby learns and adopts when using an ExerSaucer encourages poor alignment of the body and the opposite position needed to learn to stand. It may also result in your baby having difficulty learning to stand and walk, as well as putting them at risk of falling out or climbing out and injuring themselves when in one of these devices. So parents, if you are going to be using one of these, I always recommend that you set a timer for about 15 to 20 minutes at a time, and make sure your baby's supervised at all times in this ExerSaucer. Then make sure when that timer goes off to get them out and get them on the floor. Have them playing on the floor with toys, tummy time, floor time. You want to balance out the fact that you're using this ExerSaucer because, look, I know it might not be reality to just not use one altogether. You know, parents need their sanity too, but you need to balance that with getting them on their bellies, getting that floor time. And if you're struggling with doing that, please make sure to check out my other videos. I have a ton of videos on how to help you get that baby in tummy time, what to do with them, how to play with them on the floor, and some fun activities for baby. My fourth and final item that is overused by parents are baby walkers. Baby walkers are toys babies use to move from one place to the other before they learn or have the skills to walk on their own. They typically consist of a circular frame with a sling seat in the middle, which holds the baby in a similar position to the ExerSaucer. Only now this device has wheels on the bottom of it, and it allows their feet to touch the ground and propel themselves forward. This might sound really fun for your baby, but it poses some major developmental and safety risks. They are simply not safe. They allow babies to move quickly and grab and reach things that they are normally not able to reach. An infant in a walker can move more than 3 feet in 1 second. Due to the speed infants are able to move, it is near impossible for a parent to respond quickly enough to prevent injuries. Most baby walker injuries actually happen while adults are actively watching them. Some of the most common injuries from these baby walkers include head and neck injuries, skull fractures, brain injuries, bruising, cut lips, tooth damage, cut tongues, and skin injuries. Burns and scalds from being able to reach for hot glasses, stovetop pans, ovens, heaters, and kettles, to name some examples. There have even been cases of choking from the baby being able to reach toys or objects they normally would be unable to access. Babies have also sustained finger and toe injuries from the baby walker themselves having collapsed on the baby. And there also have been cases of poisoning when the baby has been able to reach chemicals or things they wouldn't normally have access to outside of the baby walker. Baby walkers can also stop a baby from developing normally, learning the proper positioning and skills needed for walking. The position of leaning forward with their toes pointed on the floor in the incorrect position needed to learn to walk can make it much more difficult for your baby to learn the correct positioning. The baby walker places them in a position of leaning forward with their toes pointed on the floor, which is an incorrect position. You do not want to learn how to walk this way. You actually can't learn to walk this way. And it makes it much more difficult for your baby to learn the proper and correct positioning needed to learn to walk. Babies need to learn to stand upright and on their feet, their weight on their feet, in order to learn how to walk. The American Academy of Pediatrics has actually stated that baby walkers do not teach babies to walk, and they actually can delay and prevent a baby from learning to walk. The American Academy of Pediatrics has also recommended the ban of all baby walkers due to them not providing your baby any developmental benefits and greatly increasing the risk of injury. Canada has gone a step further and actually banned the sale of baby walkers in the country since 2004. If you want to buy a toy to help your baby learn to walk, what you need to buy is a baby push walker. And please watch this video next to learn what a baby push walker is and how it's extremely different from the baby walker I just discussed. I hope this video was helpful. Make sure to hit that subscribe button so you don't miss out on all my videos on all things child development, parenthood, and giving your child the best start possible in life. And if you have any questions for me, make sure to comment them down below. Thank you so much for your time today and your support. I'll see you in the next video.